Good afternoon and welcome to the COVID-19 update on Channels Television. It's a daily update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. First, some of the highlights. Today, Nigeria records highest COVID-19 cases in a single day at 195. Concern heightens over spread among the vulnerable group. And expanded testing opens for millions more in England. As determined as the federal government is in reaching out to all on the need for preventive measures against COVID-19, there is still one group of persons that are most at risk in this pandemic, and they are the vulnerable. The vulnerable groups include children, pregnant women, elderly people, malnourished, people who are ill or immunocompromised, are particularly vulnerable when a disaster strikes and take a relatively high share of the disease burden associated with emergencies. And internally displaced persons, IDPs, are not left out. We talk to our guests later on the program on how this group of people can best be protected. Now, the NCDC believes that holding each other accountable would help us fight the pandemic. Taking responsibility is now paramount as the country witnesses more cases of COVID-19. According to the Nigeria Center for Disease Control, NCDC, confirmed cases of COVID-19 now stands at 1,532, with 195 COVID-19 cases, the highest number recorded in a single day. A breakdown of the 195 cases apportions Lagos with 80 cases, Kano 38, Ogun and Bauchi 15 each, Borno 11, Gombe 10, Sokoto 9, Edo and Jigawa 5 each, Zamfara 2, Rivers, Enugu Delta, the FCT and Nasarawa 1 each. Look at the state-by-state breakdown, totaling all the figures for each of the states. Lagos with the highest at 844, followed by Abuja 158 and Kano third highest at 115. You have Borno next with 53, Ogun 50, Gombe 46, Osun 34. Katsina and Edo states have 30 each, Bauchi 29, Oyo 21, Sokoto 19. Kaduna has 15, Akwa Ibom 12, Kwara 11, Ekiti, Ondo and Taraba 8 each, Delta, Abia and Rivers, also Jigawa 7 each, Zamfara 4, Enugu 3, Niger 2, and the rest of the states they're having 1 each. The death toll has also risen to 44 and 255 persons have been discharged. The Borno State Governor, David Mahi, has been speaking about the condition of the index and first case of coronavirus in the state. The state governor, while briefing newsmen at Government House, Abakaliki, the capital, explained that the index case is in stable condition and has not manifested any symptom at the isolation center. He noted that the case was caught in transit with 3 other persons, tested positive twice, and the 3 other persons tested negative twice. Meanwhile, all the people he made contact with, though not physical contact with here in the same area, have also been isolated. A number of displaced population are in Borno State, and following years of fighting the Boko Haram insurgency, since the index case, a health worker who attended 2 displaced persons in one of the local government area Borno has recorded 11 cases of coronavirus till date. Our correspondent Blessing Tuna brings us an update on the strategies to curbing the spread.
The rising number of confirmed COVID-19 cases in Borno State is raising a lot of concern only among the more informed population. Now, other fragments of the population are either indifferent or in denial, which makes the chances of further spread higher.
Fortunate that our staffs are coming down with it. One of the main reasons why our staffs are coming, I can tell you, is because patients are hiding their sickness. Patients are in denial. I will give you a story of a suspected case. She came after giving her all the instructions that she should wait. We want to take her sample. This lady left and went and had an ultrasound scan. Ultrasound scan. So this is the attitude of our people.
Now, within the week, a young man whose test results came back positive went into hiding, assisted by his mom, and it took the unrelenting effort of the surveillance team to locate him in the middle of the night on Monday. And by the time they got to him, his case had worsened and they had to put him on a ventilator.
My concern is, what is the government planning for people? What are the palliative measures? Okay? What are the government also doing to ensure that this virus is contained? Those are my concerns.
Meanwhile, the state governor had relaxed the stay-at-home order for Monday and Thursday to enable citizens restock their supplies, but on the condition that everyone must wear a face mask or at least a piece of cloth around the nose and the mouth. But unfortunately, what we saw was a lot of people did not heed that advice as people went about their businesses. And ironically, some people who had face masks were not wearing it correctly, and we actually saw people, wearing it like this, pulling it down like this, and going about with their faces exposed. Now, what this means is a lot of sensitization and advocacy will have to be conducted if COVID-19 is going to be contained in Borno State. From the University of Maiduguri Teaching Hospital, Borno State, I am Blessing Tono Aso, Channels Television News.
The Lagos State government continues the fumigation and decontamination exercise in a bid to curb the spread of COVID-19 in the state. Channels Television's crew was with one of them deployed by the Ministry of Environment while they were decontaminating a premises in the Sherry area of Lagos. The team lead, Mr. Oluwaseun Benson, told our crew the decontamination teams have carried out the exercise in over 1,700 locations considered areas of high human traffic in the metropolis. According to him, the exercise clears whatever pathogens that might be in the atmosphere or on surfaces, limiting the spread. Ultimately, the advice is to stay home.
If the agent you're actually spraying, and if it's airborne, of course you've shot a chemical agent in the air, so it has a certain control effect if it's airborne. So it can actually kill any virus that's still suspended in the air. So that would suffice. However, let me be for the record, keep it straight. There was meant to be a lockdown. Now, if citizens or residents obey that lockdown process, which means you're supposed to be indoors, certain activities will be taking place, like spraying the air and all that. But you see, we're limited with what we can do because there's everybody, not everybody is actually observing that lockdown. So that also hampers a lot of those disinfection exercise.
Well, we continue with discussions, focusing our attention on the vulnerable groups. Joining us for more on ways to stopping the spread of the pandemic is a Dr. Amina Ahmed, a public health physician, joins us via Skype from Lagos. Thank you for joining us on the program. I must begin by asking how you think that we can handle the vulnerable in a pandemic such as COVID-19.
Yeah, good afternoon, and thank you for having me. In this is something that is quite peculiar to, and it's new that that is taking everybody aback. But then the government would have to come out to do something about it, in the sense that we have the vulnerable population, like you had mentioned earlier in your broadcast, that we have the vulnerable groups. From the IDPs, we have the widows, we have the children, elderly, and all of that. So, ordinarily, Nigeria should ordinarily have a social register, but we do not have an up-to-date social register that we can use. But then, what the government is doing right now is to go through the community development associations to find out within the community who are those that are vulnerable people that are known to the community, and make a list of them, such that palliatives or relief materials can be taken to them during this lockdown period. Albeit that we can't reach everybody, but then at least the few that can be reached to give some support during this period, because many of them are day workers, some selling packaged water, some are selling things that could probably just earn them like 500 naira per day and all of that. Some earn much less than that. So they would really need, and now they can't even sell. So they really need help coming from governments, coming from CSOs, some NGOs, and even people within the community, philanthropists that can come out to help these people would be go a long way. And a lot of people are actually coming out to do that. It's just that we can't reach everyone.
Okay, database, very important. But then, Dr. Ahmed, we're also hearing from our correspondents in some of the remote areas that some people still don't believe there is a virus such as COVID-19, and that some of them are even going into hiding.
Very true. People are, even within the, not even rural areas, even within the urban areas, people don't still believe that COVID-19 is real. They see it as some sort of arrangement or so by the government. I don't know who would do that, but then that is what they are saying they don't believe in. But then the government is also trying its best to go into the nooks and crannies. Our health educators are out there every day going about telling people and showing them that this is actually real. Just that, of course, 80% of those that will be affected will come out, scot-free. They would come out cured. They would have mild diseases, and there's only a few of them that would have severe cases that would go into the list we're having and what we're seeing as deaths and in our numbers in Nigeria.
All right, Dr. Amina Ahmed, public health physician, thank you for joining us.
Thank you very much. Thank you for having me.
Residents of Kano have reacted with mixed feelings over the complete lockdown of the state announced by the government for 2 weeks over the COVID-19 pandemic, and sending, of course, the presidential task force to ensure compliance in the state. Our correspondent Nanchin Vincent went around the streets of the metropolis and some communities to check how the people are faring with the order.
I am right here at the Yankura main market. This market used to be a beehive of activities, but for now, it is lying desolate. As you can see, the security operatives are ensuring that people stay indoors and stay safe.
Yes, the federal government order is in order. We really support the program. And it is the only way that the COVID-19 will be reduced in Kano State and the whole nation. Secondly, there is a problem of our masses. Some of the people usually go out to get something for their family. And if you lock them for 2 weeks, definitely it will be going to be a problem.
As we have surrounded the market, you have seen how the huge loss we have got. Apart from okra sides, tomatoes, pepper, and very other perishable goods, we lost at least more than 40 million naira here in this market.
From Kano State, Nanchin Vincent, Channels Television News.
As the COVID-19 pandemic continues to increase in the country, more palliatives are being distributed by government and philanthropists to cushion the effect of the disease. While the communities are clamoring for more government attention through foodstuffs, the governor of Kwara State has announced that wearing of nose masks will soon be made compulsory in the state. And coming less than a week after the Kano State government deported over 400 Katsina indigene Omajuris to the state government as part of measures to containing the spread, the secretary to Katsina state government has received the Omadjuri children who were deported last night in 11 buses. Now, the state coordinator of the COVID-19 rapid response team in Kano has confirmed that the 28 new confirmed positive cases in the state are out of the 283 samples sent to Abuja for testing. Dr. Tijani Hussaini told our correspondent that although the testing center has been reopened with one additional laboratory, more results are being expected before the center resumes fully. And 3 persons have reportedly died from complications arising from COVID-19 in Sokoto State. The state governor, Aminu Tambuwal, revealed this, saying that all the 3 victims had history of other diseases such as diabetes, asthma, high blood pressure. Also, the state recorded 9 additional cases of COVID-19, making the total cases in Sokoto State to 19. We have more on our COVID-19 updates when we return. Join us again. Welcome back. We'll take you to Bayelsa State, where our correspondent, Dobra Timiwood, has the latest.
It is the second day of the complete lockdown in Bayelsa State, and residents of the state are seen complying with the directive, even though most people believe that Bayelsa State is still experiencing a partial lockdown and not a complete lockdown as directed by the state government. Pharmacies, markets, banks, filling station, and even public transport operators are still working, carrying passengers to and fro different parts of the state. So they believe that the lockdown directive by the state government is not being complied with 100%. Some residents of the state have expressed their concern regarding the immediate contact of the index case in the state. Now, some people are alleging that the immediate family members of the index case are still moving freely and they have not been quarantined by the Bayelsa State COVID-19 Task Force.
I stay in an estate where they said the first index case of COVID-19 in Yenagoa, Bayelsa State. The person resides here, and apparently the person's family members, like children and husband, I've been seeing them walk freely and given what NCDC does in other places. They're supposed to isolate them, make provisions for them like food, drugs, or whatever, then screen their blood at the end. But this one now, they've been working, and I have family members as well. I have children who want to play around. I go out myself. So if I'm having such hazard or threat, I should raise concern.
The right thing to do is to quarantine all the family members and all those that have contact with the index case, particularly the office where she works. All the staff have to be quarantined. But if they are allowed to move freely, then it's so unfortunate.
From Yenagoa, Dobra Timiwood.
Well, joining us for more on the strategies to flattening the curve and the rising figures is Dr. Adewale Agusu, a public health physician. We'd like to welcome you to the program.
Thank you for having me.
Seeing that report and, some of the fears of those people in the estate, it also draws perhaps more importance to surveillance and the importance of contact tracing and, some of the NCDC guidelines which people need to listen to and adhere to.
Yes, like you said, contact tracing is very important. When you isolate, now you're isolating to reduce spread. Now, after isolating this person or this index case, like she said, you have to trace everybody that he or she has had contact with.
So in this case, would that be a laxity with the officials in Bayelsa?
Well, I wouldn't. There could be some apart from logistics shortfalls but like she said, the index person was gallivanting. Let me use that word, up and down, and the NCDC ought to immediately line list the people for which he has had contact with. Then you start to monitor their vital signs, their temperature, to see how they are faring. We have officers called disease surveillance notification officers, who are the DSNOs. They will give them thermometers to monitor their daily temperatures and ask them questions. Every day you monitor them.
So this is all, the personal responsibility people need to take in this regard. Tell us about Oshodi Solo area, the local government area where you work.
Okay, yes. I work in Ijigbo LCDA. It's under Oshodi Solo. Initially, when we started going around, we were doing active case search. Yes, we had to go into the community and private facilities, both private and public facilities. When we went to the community, we met with resistance, some resistance, because people were clamoring for stimulus package. Some even told us, if you have not come to give us stimulus package, just leave. We don't want to see you in our community. However, some of them were cooperative. And in the private facilities, we go there, we ask questions on the symptoms of cough, flu, sore throats in the past 1 month, just to identify cases that might have been overlooked. So when we get there, then we now upscale it to the NCDC. If we get any positive when they come, they pick, they isolate.
Finally, do you think there have been any misconceptions as to what COVID-19 is in the area?
Yes. Some people were saying that it's a form of it's a fallacy. Government is trying to siphon money. They even joke. They say, oh, Kuru people they've come. Oh, you guys are the reigning. I said, no. Even as yesterday, I was still talking with one of my roadside mechanic. And I feel the information should be brought down to the local level, to translated in different local dialects, so that people will understand. He was telling me that, sir, this Koro is for the rich people. They are the one that brought it. It's not, let them just release us. I had to sit him down and explain to him so that he now realized that, whoa.
It's real, it's here. Yeah. And it's not going away anytime soon.
Well,
we appreciate your time, Dr. Adewale Agosu, public health physician. Thank you for joining us on the program.
Thank you so much.
And the United Kingdom government has expanded testing beyond just essential workers and hospital patients, making way for about 25 million people to book tests. The staff and residents of care homes can now be tested even if they don't have any symptoms. The government has pledged to do 100,000 coronavirus tests a day by the end of April.
The United States has confirmed over 1 million coronavirus cases, making up almost a third of the total global tally. With over 58,000 deaths, more Americans have now died with COVID-19 over a few months than died in the Vietnam War, which lasted nearly 2 decades. In positive developments in Asia, Vietnam has recorded no new cases today, meaning 13 days have passed with no signs of community transmissions. It's been about a week since the country eased a nationwide lockdown, and life is slowly returning to normal. The downward trend continues in South Korea, where, after ballooning in February, daily infections have reduced drastically. Only 9 fresh cases were confirmed today. But in India, infections are slowly climbing. With just over 30,000 cases, the country now has the second highest number of infections in the region. Over in Europe, France is the latest country to set out plans for easing its lockdown. Many shops will reopen from May 11th, but bars and restaurants will remain closed. Coronavirus testing is now available for millions more people in England from today, after the government loosened rules on who can apply. Expanded eligibility now means care home residents and staff with or without symptoms can request testing. And it's a boy. Prime Minister Boris Johnson and his fiancée, Kerry Simmons, have announced the birth of a healthy baby boy. Both had suffered from coronavirus, but Prime Minister Johnson's illness was far more severe as he received treatment at an intensive care unit at a London hospital. And finally, in the Philippines, one couple have named their newborn COVID Marie. The parents say that they wanted her name to be a reminder that the virus did not only bring suffering, as despite everything, a blessing came to them.
COVID Marie, what a wonder. Well, the Nigeria Center for Disease Control says, remember, face masks are to be worn in combination, social distancing, regular hand washing, and of course the physical distancing as needed. Their website has live updates on the advisories. Also, the World Health Organization rolling updates. You can take a closer look at some of the numbers, cases, deaths, recoveries, efforts across board in real time. And that's our COVID-19 update on Channels Television. Thank you for watching. Another update comes your way again at 6 p.m. I'm Innocent Walker. See you soon.